Wenbing Tiaobian, authored by the Qing Dynasty physician Wu Tang. Chapter 2, Upper Jiao section, sections 28 to 34-28. If there are symptoms of heat in the Hand Taiyin, lung meridian, but there is no phlegm when coughing, and the cough sounds clear and melodious, this falls into the category of clearing the lung collaterals. You can use the Clearing Collaterals Decoction, and add licorice, balloon flower root, sweet almond, Ophiopogon japonicus, and Anemarrhena rhizome for treatment. If there is no phlegm when coughing, no accompanying throat itch or soreness, and the cough sounds clear and melodious like the tinkling of gold or silver, it indicates that the problem may be due to excessive lung heat rather than dampness. In this case, you can use the Clearing Collaterals Decoction and add some medicinal herbs for adjustment. Clearing the lung collaterals targets the intangible excessive heat in the lungs. Licorice is added for its exterior releasing and opening properties. Balloon flower root can disperse lung qi and open the orifices. Sweet almond has a moistening and cough-suppressing effect on the lungs. And Ophiopogon japonicus and Anemarrhena rhizome can nourish yin and clear the lungs, suppressing the heat. The specific preparation method is to add 1 qian of licorice, 2 qian of balloon flower root, 2 qian of sweet almond, and 3 qian of Ophiopogon japonicus to the Clearing Collaterals Decoction. This formula can help clear the lung collaterals, balance excessive lung heat, and improve the symptom of clear and melodious coughing. Please note that the term qian is a traditional Chinese unit of weight, approximately equal to 3.75 grams. 29. For patients exhibiting both symptoms of heat in the two Taiyin, spleen and stomach meridians, along with coughing and throat itch, with a deep, muffled cough and abundant phlegm, but without a strong thirst or a pressing need for increased water intake, you can use the minor buplurum decoction with pinelia and almond. Additionally, add hoopoe, magnolia bark, and xingren, apricot kernel, for treatment. When a patient presents both coughing and throat itch, increased phlegm and a deep, muffled cough, the muffled sound suggests the presence of earth dampness within the body. If thirst is not pronounced and there is no urgent need for excessive water consumption, it indicates the possible coexistence of water dampness in the body. This is a typical characteristic of summer heat-related illnesses combined with water dampness. Therefore, using the minor buplurum decoction with pinelia and almond can alleviate water dampness. By adding hoopoe and xingren, it helps clear the lungs and transform dampness, preventing the occurrence of chest congestion. Gan lan shui, sweet koi seed water, is used to eliminate water dampness without stagnation. The preparation method for the minor buplurum decoction with pinelia and almond, along with hoopoe and xingren, is as follows: banxia, pinelia, 8 grams, fuling, poria, 6 grams, hoopoe, magnolia bark, 3 grams, fresh ginger 5 grams, and xingren, apricot kernel, 3 grams. Boil gan lan shui in 8 cups of water, take 3 cups, warm it, and consume it 3 times a day. This formula is suitable for treating summer heat-related illnesses with water dampness characteristics, and aims to improve symptoms of coughing, throat itch, and excessive phlegm. 30. If a patient exhibits a weak pulse, experiences difficulty in peaceful sleep at night, feels restlessness and thirst, and has a red tongue, along with the following symptoms, often keeping the eyes open and finding it difficult to close them, or conversely, having a preference for keeping the eyes closed and struggling to open them, it may be due to the invasion of summer heat into the Hand Taiyin, pericardium, meridian. In such cases, treatment with the Qing decoction is appropriate. However, it's important to note that if the tongue appears white and slippery, this formula is not suitable. Difficulty in peaceful sleep at night may result from weakness of the shen, spirit, preventing yang qi from entering the yin chamber. Restlessness and thirst indicate excessive heart fire and a weakened heart, and the eyes remaining open may be due to ocular heat, urgently needing release, while yang qi cannot descend to harmonize with yin. The function of the Qing decoction is to promptly clear heat evil from the body while preserving the yin-deficient state of the heart. If the tongue appears white and slippery, it suggests not only the presence of heat evil but also dampness evil, and in such cases, the Qing decoction should not be used. The preparation method for the Qing decoction is as follows: 11 Jiao, rhinoceros horn, 3 grams, Sheng Di Huang, Rihania, 5 grams, Yuanshan, Panax noto ginseng, 3 grams, Juishin, bamboo leaf heart, 1 gram, Maidong, Ophiopogon root, 3 grams, Danshaw, cinnabar, 2 grams, Huang lian, Coptis rhizome, 2.5 grams, Yinhua, honeysuckle flower, 3 grams, and Lian Tiao, forsythia fruit, 2 grams. Boil with 8 cups of water until it reduces to 3 cups, and take it 3 times a day. This formula possesses properties of saltiness, coldness, bitterness, and sweetness, effectively clearing heat and nourishing yin deficiency, making it suitable for treating summer heat-related symptoms. 31. For symptoms of summer heat-related conditions affecting the Hand Taiyin, pericardium meridian, where the body feels hot and not cold sensitive, and there is a lack of mental focus, often feeling uncomfortable, you can use Anemarrhena Wan or Zhixue Dan for treatment. Sensing heat in the body without cold sensitivity indicates the absence of symptoms related to the Hand Taiyin meridian. Mental confusion and frequent discomfort require special attention to prevent the development of an interior blocking condition. Therefore, it is necessary to use medications with aromatic opening and bitter cold clearing properties. Note, Anemarrhena Wan and Zhixue Dan are traditional Chinese herbal formulas used to treat various conditions, including heat-related symptoms affecting the heart meridian. These formulas often contain ingredients such as Huang, Calculus bovis, and Realgar, arsenic sulfide, which have been used in traditional Chinese medicine for their therapeutic properties. It's important to use these formulas under the guidance of a qualified traditional Chinese medicine practitioner, due to the presence of potentially toxic substances. 32. In hot and humid weather, if a patient presents with a white tongue coating and does not experience thirst, along with symptoms of hematemesis, vomiting blood, this condition is referred to as shuzai, and is considered challenging to treat. Treatment can involve the use of Qing Dynasty with almonds, koi seeds, and talcum powder decoction. In this scenario, the invasion of heat evil affects the surface, and the presence of a white tongue coating indicates the existence of damp evil, both involving the qi aspect. Since hematemesis is also present, both the surface qi and blood are affected. Treatment needs to clear heat, detoxify, and restore harmony without damaging weakened qi. Therefore, Qing Dynasty is used to clear heat evil from the blood vessels without harming the Hand Taiyin meridian. The addition of almonds helps regulate qi circulation, while koi seeds and talcum powder assist in clearing dampness evil, with the hope of dispelling the pathogenic factors and restoring a balance in qi and blood. The preparation method involves adding 2 grams of almonds, 3 grams of talcum powder, and 3 grams of koi seeds to Qing Dynasty, and the method of administration remains the same. This formula is suitable for treating hematemesis resulting from summer heat-related conditions, combined with characteristics of heat and dampness. 33. In young children, sudden symptoms of body heat, convulsions, and coldness in hot weather are referred to as shufu. Treatment can involve the use of Qing Tang, and in moderate amounts, Zhixue Dan can also be used. Children's yin qi is relatively fragile compared to adults, especially in scorching summers when they are susceptible to the invasion of summer heat. Symptoms may occur suddenly because wei qi enters the yin qi. Children's organs are relatively weaker, and their blood vessels are easily threatened by pathogenic heat. When pathogenic heat is extremely dominant, internal wind may also arise, commonly referred to as acute convulsions. In such cases, it is essential to clear heat, disperse wind, and eliminate congestion to prevent the rapid progression of the illness, which can be life-threatening. Therefore, using Qing Tang can clear heat, preserve body fluids, ensure sufficient bodily fluids, and naturally lead to sweating, thereby alleviating the condition. However, it's crucial not to induce excessive sweating. The moderate use of Zhixue Dan helps clear heat from the body's protective layer while simultaneously opening the inner orifices. 34. For adults experiencing symptoms of shufu, a similar treatment approach can be adopted. When pathogenic heat initially invades the yin qi, leading to liver wind stirring internally and causing symptoms such as convulsions in the extremities, you can add medications like Godan, agate, and Pai Ling Yang Jiao, antelope horn, to Qing Tang. Please note that in the Qing Dynasty, 1 qian is approximately equivalent to 3.73 grams now. To be continued.